name is Monique Williams.
And I'm Amanda Dickinson.
And this is our community health presentation on our public health nurse. So we chose public health nursing to do our community health nursing. And we went to the Florida Department of Health to interview our particular nurse. So first of all, what is a public health nurse? It's a nurse that combines nursing theory and public health theory to promote and preserve the health of populations. So basically what they do is they look at the community as a whole instead of just focusing on the individual, and they treat the entire population and focus on the health status of the population. So they prevent disease and disability. So also they promote and protect the health of the community, and also community health nurse is also synonymous with public health nursing. So just the origins of public health nursing, it began with Lillian Wall. She, along with Mary Brewster, started the Henry Street Settlement, and what they did was they went out and visited the poor and they treated them, and then that turned into the visiting nurse service of New York City. So they were pretty much the pioneers for public health nursing. So I'd like to introduce you to a modern day public health nurse, Ms. Tawanda Washington. She is the TB refugee supervisor at the Florida Department of Health. So the primary activities and scope of practice. The Duval County Health Department no longer treats adult primary care cases. They do still treat pediatrics, so kids can actually go and be seen for primary care services at the Duval County Health Department. They also do epidemiological surveillance. So what this includes is if you have a patient that has whooping cough or scabies or even tuberculosis, they actually go out into the community and provide them with information, and they assess the entire family. So if they're living with several different people under one roof, they treat the entire family if they feel like they've been exposed to whatever the chronic disease state or communicable disease state is. They focus on prevention, which is key. So they give them all the necessary tools. They go out into the community and educate patients or potential patients on how to prevent heart attacks, how to prevent high blood pressure, how to prevent themselves from getting diabetes, and also how to prevent from the spread of communicable diseases. There's a lot of Medicaid patients that come and visit the Duval County Health Clinic. So a patient can't afford medical services through, say, maybe their own personal primary care physician. This is another option because they do treat a lot of Medicaid patients. So they really focus on that particular demographic. So some of the federally qualified health centers, and like I said before, the adults can't go to the Duval County Health Department. They actually can go to the Agape Center. So they have some community-oriented health centers that are federally funded, and they provide adult primary care health services. So there's one on West Connect, and there's also one on Edgewood Avenue. They also provide STD services and immunization. So this is something that's very important, especially with kids going back to school, making sure that they have their immunizations. So they actually can go to the health department if they don't have a primary care physician, and they can get their immunizations done there. Also, patients that have STDs, they can be treated there at the health department. They also do women, infant, and children's, or better known as WIC, so that the mother and the baby can get a healthy start. They make sure that they have the nutrition that they need throughout their pregnancy, and then once the baby comes here, they can still continue on that. And then also HIV. Given the stigma with HIV, patients can actually go to the health department and be treated there. Also keeping the end in mind, it's very expensive to treat this particular disease state, so that they can go to the health department and get a lot of their medications and treatments so that they don't fall behind or be non-compliant. Teaching and learning strategies. One of the things we asked Ms. Tawanda was, how is it that you're able to reach the patient? Like, how do you get them to buy into what it is that you are telling them? And she says that she just has to have patience and really try to meet the patients where they are. So if she sits down in a home or in her particular facility or wherever she goes and meets the patient in the community, she tries to assess the entire patient and also anyone that might be with the patient. So are the clothes clean? Do they look hungry? Do they look clean at all? Do they look like they haven't taken a bath? So she really tries to be very observant, but with a very straight face and not be judgmental. But a lot of times she says that it's very telling when you see the children with the parents and their clothes don't look to be clean and they don't look like they've been washed in weeks, or the fact that the kids just don't look like they've taken a shower in a long time. Also, she looks to see what are they eating, what do they have with them, do they have a lot of belongings with them, is there anything about the patient or their family members that would give them the impression that maybe they might be homeless, they don't have a place to live. So she tries to be very observant. So also she tries to survey them again while she's talking to them and just see if there's any clues that would make her think that maybe they're homeless or they can't afford medications or afford a doctor or have any place to go to be treated. So another thing she said is that she tries to know the community and how things are laid out. So typically if she's in an area where there is not enough grocery stores in close proximity to homes, then chances are this patient doesn't have access to quality foods. They may not be able to go to the grocery store and get fresh fruits and vegetables. And if there's a lot of fast food restaurants in the area, that's probably what they're eating. So she tries to really study the community to really understand where the patient is. Also, if there's bus routes around, so how are these people getting around? How can they be transported from point A to point B? Do they have access to a vehicle, or are they having to just use public transportation? Are they on the right route? So those are the things that she really tries to pay attention to. And she also wants to inform clients of services available. A lot of people don't do better because they don't know any better. So typically, patients don't have access to care sometimes because they just don't know that there is the availability of particular programs or resources in the community. So she really tries to inform patients of that. So we asked her if there were language lines, because there's so many refugees and people coming from other countries into the country, migrating in, and she said there is. So basically, no matter what demographic or what nationality, patients can still have access to care, and they meet them through this availability of the language line. And also, the one last thing that she said is that they try to use what people use. In this day of modern technology, a lot of people go to social media, and they also use the radio and television as their source of communication. So she really tries to make sure that they broadcast things on radios about health fairs or community events so that the public is aware, but tries to meet them in an arena that they actually can relate to. So with that, I will turn it over to Amanda.
So we asked Wanda what special education did she get. She has a Bachelor of Nursing, of course. She first started out as an LPN. She loved it. She decided to go back to nursing school, and she decided once she got done, she wanted to be in public health nursing. That was her first job she had. She did a few other things before she decided to be a nurse. So she had built up her customer service skills before that. So it helped her to develop relationships with patients. Most of the patients that she sees, being a TV nurse, she tracks over years. She actually has to track these people. So she gets to know their families. She has to go in and test their families. They have to stick to a certain regimen with certain drugs. They can't drink while they're taking their TB medication, and a lot of these patients are homeless and drug addicts and alcoholics, so they really have to develop a program for that. Also, we found out, which was interesting, if a TB patient is not compliant with their medications, then they're placed in the hospital. They can be placed, first they're placed in the hospital. If they don't follow the regimen, then she can actually go to court and get an arrest warrant for them, and they're actually sent to jail. Duval County has a special unit for them to make them compliant with their medications, which I thought that was interesting. Other disciplinaries that she works with, being in the TB clinic, being in public health, our dentist. I thought it was interesting that she actually has a nutritionist that she often works with. Of course, physicians, epidemiologists, of course, and x-ray techs. They actually have an x-ray unit there at the Duval County Health Clinic, which I also found was interesting. I had no idea all that was in one little building there. Again, her skills that she uses on a daily basis, of course, is customer service skills. People come in, they're scared, they don't know what they're doing. She has to learn how to interact with people. She has a lot of foreign people that don't speak English well, so she has to learn how to communicate with them also. Case management is a big thing because of the TB patient. She has to make sure they follow up with their care. And of course the clinical skills, because they do have a clinic there in the TB office where they see patients on a daily basis. The entire clinic there's several clinics within one building in the Duval County Health Department. Her area is actually uses the negative air pressure. The air conditioner recycles all the air in the entire clinic every 15 minutes. There's also UV lights in the air conditioning units that filters out the air. And I also found interesting, I had to ask her if she ever came up positive for a TB test, and she said so far she is not, and she's been working there for the past 12 years. So after the closure of the state TB hospital, due to all the cases that came up a few years ago, UF Health in Jacksonville has a TB unit, and Jackson Memorial in Miami also has a TB unit. So right now those are the only two hospitals in the state of Florida that actually have enclosed TB units there. Also we found out, which was interesting, was they have a program called HERAP. Never knew this existed. It prevents people from going to the emergency room to treat their chronic illnesses, diabetes, high blood pressure, etc. People wait till they get real sick, then go to the emergency department to get their free medication or get their prescriptions for their medication. So HERAP tries to prevent that. It connects the clients with primary care doctors that agree to do services for them at a discounted rate. They also have a pharmacy there at the Duval Health Clinic, which offers medications on a sliding scale. That's how they charge for all their patients. They use the sliding scale, what they can afford to pay, they pay. If they can't afford, then they don't pay. Most programs that they have with the Duval County Health Department are run by nurses. Majority of the clinics are nurse only. All of them are registered nurses. They do have a few nurse practitioners, and they do have a few medical doctors that will write prescriptions and come in and see patients. But for the most part, immunization center and the TB center are completely run by registered nurses. And we also found what was interesting was when a person legally comes into the country, they're called a parolee, and they're set up with their local health department. In Duval County, it's the Duval County Health Department. They receive 8 months of Medicaid to get them started in the country. So the whole family or individual will get free medical service for 8 months. So in that time, they have to go through all their immunizations. They try to hook them up with insurance, so once the 8 months is over, they will continue to have some kind of health care service. And these are some of these services that are offered at Duval County Health Department. Inside the health department that we were in, they had a dental clinic and a women's wellness pregnancy center and the TB office, along with the x-ray office and a pharmacy. But they offer, of course, women's health care, pediatric health care, the maternity health care, immunizations, again, the STD testing, HIV testing, the tuberculosis, refugee health care, WIC. They have the dental clinics, pharmacy, and they do the birth and death certificates, and have environmental health programs in emergency preparedness and response. And that's it for our presentation. We really enjoyed speaking with Wanda Washington. It's very interesting to see that type of work being done. And I encourage people, she said, anytime anybody would like to come in and maybe see the clinic, see what they do there, that they're welcome. They have a fairly large clinic there that does different programs, so that's something, if anybody's interested in, that's something that can be arranged, and I thought was very interesting. Thank you.
Thank you.